don't know if this answer's correct.
All right, I'll check it when I'm done.
You done?
When I'm done, yeah, I'll check it.
I always have to do more work.
Well, wait till I'm done, and then I'll help you finish.
Well,
Hello, hello. Where's the comments? All right, so do another quick one today. Just touch base with everybody, say hello. Hope everybody's having a good start to their week. Sure. Let's see. I have a go live request with somebody on Instagram. Let's see. Hey, cool. Hey, Lydia. Hey, Rachel. Aw. Look at my little diehards over here. So, real quick, we'll just go over all of our little specials we've got going and any new upcoming things. No specific topic tonight. Unless you have a request, I can go over something for you. I was just going to go over our specials and a new anti-aging thing that we are going to implement or start providing, which is NAD+. So NAD+ is an injection. You can do it subcutaneously, like in the fatty tissue, or you can do it intermuscularly, or you can do it IV. So NAD is something that our body produces anyways. It is very high, in high levels, when we are younger. Hang on, Rachel, I'll get to you. I'll leave it up here so I don't forget. It's in very high numbers when we're young. As we age, the NAD levels come down. NAD is important for our cells to function correctly. So this is something that works on a cellular level, or in the mitochondria. So the mitochondria is basically like the engine or the powerhouse of the inside of the cell. Mitochondria are what's responsible for breaking down food to be utilized as energy. It also helps in cellular reproduction with DNA and RNA synthesis and making sure that those molecules are copied correctly. So as this decreases when we age, we get cellular damage. And so this is thought to progress other diseases like Alzheimer's, Parkinson's, fibromyalgia, chronic pain, inflammation, those kinds of things as the NAD decreases. So the thought process is to bring that level back up to help combat these diseases, to help our cells function like they did when we were younger. So it gives you more energy because your cells are functioning how they're supposed to function. They can utilize that food that you eat as energy more efficiently. It decreases inflammation because these cells are, when they're replicating, they're able to kind of get rid of those other cells or those faults in the DNA or the RNA to help you replicate healthy cells. So it will increase your cognitive function, mental clarity, decrease Alzheimer's, like I said, decrease the risk of Parkinson's, decrease inflammation, increase energy, increase metabolism. It helps with pain management just because of the decrease in the inflammation. It can help reverse skin damage just because your cells are able to clean up those oxidative stressors better. So it's a big antioxidant. So that we get exposed to antioxidants every day, right? And then when we get stress added onto us, then we get even more antioxidants, and those are damaging to our cells. So this helps kind of clean those up. So it's going to give you smoother skin, help with fine lines and wrinkles, help with collagen repair. It also aids in fertility, right? So if that's something you're looking to do. So I am starting to offer that. I've experimented on myself with the injection. So basically, when you come into the office and you want to do an NAD injection, you can do it one of those three ways, like I said. So either subcutaneous, intramuscular, or IV. If you any of the ways, it's got to be monitored the first time that you do it. So what can happen is it can cause a flushing of the skin, it can cause an increased heart rate. Those are all transient and will fade rather quickly. I start everybody off at a pretty low dose, and then once you can kind of tolerate that, then and I know that you can tolerate the medication, then I can give you injections that you can take home. And typically, what people do is they'll take it twice a week, like by subcutaneous or intramuscular injection, for the first month, and then after that, once a week for the next month, and then after that, once a month. And that's just to help sustain those NAD levels. So I did an injection on myself. When was it? Saturday, I believe. And typical starting dose is 50 milligrams. I did just a 25 milligram just to see how I would tolerate it. And I felt fine. I did get a little flushed. And it was oddly enough right at that 10-minute mark. I got a little bit flushed, and my heart rate did go up to about 106. And that lasted for about a minute, and then it was back down. I just felt like warm. So then the next day I took the other half of the dose, the other 25 milligrams, and that I didn't feel it at all. Then what I did today is I took the full dose of 50 milligram, and again, right at that 10-minute mark, I felt flushed and I just felt like warm, like my muscles felt warm. And my heart rate did go up, not as high, maybe in the 90s. But again, that was transient, lasted maybe a minute, and then it was right back to normal. So when you do your first injection, that's going to be monitored by me. You'll get the injection, and then you'll stay in office at least 15 minutes. So I can just kind of keep an eye on you and calm you down if those things happen. So you can be assured that they will go away and you're not going to die or anything like that. Um, and then after that, you're good to go. You can take them at home on your own. If you do it via IV infusion, that's a higher dose, typically anywhere from 100 to 500 milligrams in that IV dose. And that needs to be in office. You need to stay with me in office. And it's a very, very slow IV drip. It takes about 4 hours, and oftentimes longer than that. People will have to even slow it down even more. They'll get that flushed response and that elevated heart rate, and so you just slow it down so you're not feeling those effects. It is more effective via IV, but I realize that many people can't sit in my clinic for 4 hours to get an NAD infusion twice a week when they start. So it's just more convenient to do it subcutaneously or intramuscularly. So that being said, I'm now offering that if you guys are interested. I'm trying to do more anti-aging wellness, bioregenerative type medicine. That's why we're doing the hormone replacement. I'm looking into the NAD. I'm looking into Samoralin, which is another product like NAD, which is a big anti-aging peptide. So I'm trying to just do more of that, like the Sculptra, the PRP, all those things. Hi, Stephanie. So I really think the future of aesthetics or wellness medicine is going to be on that kind of stuff, anti-aging, and getting your body to do its own thing as opposed to like synthetic medications or filler, that kind of stuff. So I really think that things are going to start heading that way. So I'm trying to kind of be on top of it with the new research and stuff. Yeah, Doreen said it's interesting. Yeah, you can look it up, Doreen. You can also look on our Instagram. I posted just a brief informational blurb about NAD, and I also linked an article that was published through the NIH, excuse me, about the benefits of NAD and kind of where that's going to. So that being said, we have expanded our space, and I have more treatment rooms. If you haven't heard, we have a new logo. If you haven't seen it, so a whole new year, new us. So the specials on that note are focused on weight loss. So 2 months of semaglutide, $400, 2 months of tirzepatide, $800. We are still offering the membership. If you buy 2 months, you get 1 month for free. There are several things that are included in that membership, like that you can get every month: complimentary B12 injection, in-body assessment, IV therapy, or IPL, like photofacials, those kinds of things. You can kind of pick one of those every month to do. And then in addition to that, you get a 15% off anything else that you purchase, and that will include products, which I'm hopefully getting in sometime this week, some skincare product lines. And then you'll also get discounts on filler, Botox, Dysport, Xeomin, that kind of stuff. So those are the specials. I think we are still doing the hydradermabrasion special for $79, and then the dermaplane special is now $47. So if you're looking to do those, book those soon, because Michelle is filling up quickly, and she's going to be on vacation that last week of January. So that week is like blocked off. So she is going into February with those bookings. So if that's something you're interested in doing, book that sooner rather than later. And you can always call and prepay, and then you'll have that on your account. And then when she comes back from vacation and it's more convenient for you, you can go ahead and schedule that with her. I think that's all I have. I'm still waiting on my microneedling with RF. That's what Rachel's asking me about. Did we try the new machine? Not yet, Rachel. So it's coming from northeast somewhere, when they had tons of ice storms. So it was delayed due to that. I think it just shipped out either Saturday or today. So hopefully I will get that in a couple days, and I will be looking for some guinea pigs to try that out on, including myself. So I'll make a post about it. Obviously we'll do like a model call where we'll offer the treatments at a significant discount, just to start using it and getting people used to us having it and everything. So that being said, does anybody have any questions or comments or anything they would like me to discuss? Going once, going twice. Let's see, we got Doreen. I have on Instagram, one of the people who's watching live, they're called they're a company based out of Port St. Lucie. They're called Neon Freaks. They make neon signs. If you guys get a chance to look them up on Instagram or on Facebook, they do. Yeah. They do some really amazing work, and they just worked up a draft of a that's my daughter. They just worked up a draft of a neon sign that I'm hoping to get soon. That'll be right behind our new reception desk after I get finished tiling it. So the expanded place is still a work in progress, but I'm getting there. I'm working on it. So again, that's Neon Freaks. They do some great work. They did a friend of mine's new sign. She kind of did a rebranding also for the new year, and her new sign came out great. She's another skincare girl. She's actually right down the street from us down Port St. Lucie Boulevard. And her main focus is acne. So like younger people usually, or some women, get adult onset acne because the perks never end with being a woman. So if you guys get a chance to check them out. Or if you need a neon sign for anything, they do some really great work. Lydia asked if, hang on a second, let me write this down. Noelita. Lydia asked how much the NAD costs. So basically, it's going to be $1 per milligram. So if we start you off at 25 milligrams, it's going to be $25. But again, you want to do that twice a week for the first month. And then just based on your tolerance, then we can increase it there. The goal with the subcutaneous or intramuscular injections is you can go all the way up to like 500 milligrams once a week. But that's obviously something you need to work your way up just so you can kind of mitigate that flushing response that you get. It's kind of like niacin. If you guys have taken niacin before, sometimes I'll tell people to take that if they have high blood pressure and they're kind of hesitant to start blood pressure medication, then I'll recommend niacin. Because that is a vasodilator, so it dilates the blood vessels and you get that flushing response. There's a no flush niacin that is a slower release niacin, so you don't get that flushing response. But that's kind of what it felt like for me today when I did it. It just felt like warm, just that flushing response. So, anything else? Anybody else? Going once? Going twice? So, Liam, do you want to pick somebody? We're going to pick a winner. So, we have Lydia, Rachel, Stephanie, Doreen, and Nolita. Oh, you need a pen.
Which one's the nail?
Either one. It's doing eeny meeny. All right. Noelita. She is going to win. What should we give her, bud? Let's do a free. Oh, we haven't done this in a while. Let's do a free M-Sculpt treatment. So, M-Sculpt. Correct. I'll get back to you, Doreen. M-Sculpt is the machine that kind of does a workout for you. So you can use it on your abs, on your glutes, on your quads, your biceps, basically whatever. And it's like doing 20,000 squats in 20 minutes or 20,000 crunches in 20 minutes. So it gives you a pretty good workout, and it also uses radio frequency to decrease some of the fat. You'll be sore the next day. But it's a pretty nice little machine to just hop on. When I had time, I used to do it like once a week, but I haven't done it in a couple months now. So we'll do that one. Okay, so Doreen on Instagram asked, she must have been looking this up while we were talking. I'm understanding that this is a long-term process. She's talking about the NAD, not a one and done. You need to continue long-term for good results. So this is correct, right? And that is because as we age, we start to our NAD plus levels start to decrease. So now we're supplying it exogenously to try and boost it back up to the levels we had when we were young. So they're not going to stay high after you're done with the injections. So this is something that if you're going to do, it's going to be a long-term commitment for better health in the long run. So yes, that's true, Doreen. You do this initial like loading phase the first couple months, and then after that is kind of a maintenance program. And again, you just do it, like I tell people, like with the B12 injections, that you just do it kind of based on how you feel. The first couple weeks I start people on B12, I'll do it twice a week, and then we'll go to once a week, and then we'll go to once a month, and just kind of build that level up, and then keep it high. But I tell people, once you're up there, you feel better, right? And then you can tell when those levels start to deplete. You start, feeling more fatigued and that kind of stuff. And so then I tell them, well, that's when you need to do another shot. So it'll be a similar kind of process like that. Anybody else? All right, guys. I'm all done then. I've talked enough on your Monday evening. So you guys all have a great week. Rachel, I will let you know when the machine comes, so you can come in for your treatment. And I will see you guys on Monday. If you guys need anything, feel free to call me at 772-207-0080. You can also text that number. I'm pretty much available all the time. So feel free to call or text, and I will see you guys next week. Good night.